In this procedure, you'll learn to use restatement, reflection, and clarification to obtain patient information and document patient care accurately. To put the patient at ease, greet him pleasantly, identify him, introduce yourself, and explain your role.
Hi, Mr. Dixon. I'm Laura. I'm going to be updating your medical record today.
To protect confidentiality and prevent interruptions, choose a quiet, private area for the interview.
We're updating our medical records, and I just want to make sure we have all your information correct.
Explain why you need the information. Complete the history form by using therapeutic communication techniques. Record the patient's full name, including middle initial, his address, including apartment number and zip code, marital status, gender, age and date of birth, telephone numbers, home, cell, and work, insurance information, and the name, address, and telephone number of the patient's employer. If any of this information has already been entered into the electronic record, verify that it's still accurate.
I have your full name as Oscar Curtis Dixon. Is that correct?
That's correct.
Can you tell me your date of birth?
11/16.
A self-history may have been mailed to the patient before the visit. If so, review it for completeness. Speak in a pleasant, distinct way, remembering to maintain eye contact, if, of course, it's culturally appropriate to do so.
And marital status?
Married, 2 kids.
Positive, nonverbal behavior creates a friendly, caring atmosphere.
Okay. What brings you in the office today?
Well, I've got shoulder pain, but, well, the worst part of it is it kind of wants to catch.
Okay.
I don't know.
Okay, so your left shoulder hurts and sometimes it catches?
Yeah.
Be sure to use restatement, reflection, and clarification. Be sensitive to the patient's needs throughout the interview process. Be aware of your personal biases and treat all patients with respect, whatever their background.
Dr. Steele will definitely take a look at your shoulder. Do you have any other symptoms or concerns?
Well, I mean, overall, I'm starting to wonder if I'm getting my dad's arthritis.
Tell me more about your dad's arthritis.
Well, I don't know much. I mean, to hear Mom tell it, it's rheumatoid. So,
Sure.
I mean, that's all I know.
Sure, that's
Be sure to explain any medical terminology.
I'll make a note here of your father's rheumatoid arthritis. That way the doctor can be aware of your family history.
Document the patient's chief complaint and present illness, his past medical history, and his family and social history. The provider will need this information to make an accurate assessment and diagnosis.
I'm going to ask some questions about some different body structures. Are you ready?
Yeah?
Okay. Have you ever had any cardiac problems?
What's that?
Cardiac means heart. Have you ever had any heart problems?
In the correct field of the patient's EHR, enter information about his allergies to drugs and any other substances, such as latex or certain foods.
Do you have any allergies to drugs or any other substances that you know of?
Well, I'm allergic to bees, but I carry an EpiPen. But as far as any other allergies, none that I know of.
In a paper file, record any allergies in red ink on every page of the history form, on the front of the file, and on each progress notes page. Spell correctly, write legibly, don't skip lines, and don't erase or mark out anything. If you need to correct a mistake, the EHR will automatically note the time of the change and the name of the user who made it. Remember to thank the patient. Patient information may be legally and ethically shared only with members of the healthcare team directly involved in caring for the patient. Safeguards mandated by the Health Insurance Portability and Accountability Act, or HIPAA, include using secure passwords, placing shields on computer screens that might otherwise be visible to unauthorized people, positioning monitors away from high-traffic areas, and securing all medical records.